Sorry for the lighting. It's really bad. It's the middle of the night when I decided to film this video. People are quick to judge you. People are quick to judge me. People are quick to judge anyone who admits to having mental illness, especially not one of the trendy mental illnesses, if there is such a thing. But you know, and I know that there is such a thing. My name is Gillette Arias. That is not my real name, but that is what you can call me. And I am diagnosed with bipolar disorder. More specifically, bipolar 1. I do cycle rapidly, or I did cycle rapidly between manic episodes and depressive episodes. However, I take lithium to help with both the bipolar disorder itself and the depression. It's not perfect. It doesn't work 100% of the time. So I also take Celexa as an antidepressant. Unfortunately, the drugs that I have tried, which are antipsychotics for my manic episodes, do not work for me. And so, while my manic episodes have been reduced in severity, they do still occur. So, what I've specifically been diagnosed with is bipolar 1 disorder because I have experienced manic episodes. During my most severe manic episodes, I have auditory and visual hallucinations. I am extremely reckless when it comes to money, when it comes to spending, when it comes to gambling, when it comes to a lot of different things. Lack of regard for the feelings and intentions of people who have my well-being at their best heart. And also an inability to understand consequences of actions that I take. Ironically, or not ironically, I guess maybe some people can relate to this, especially if you understand these symptoms. During manic periods is when I am more likely to self-harm, as well as more likely to have suicidal thoughts and or suicidal actions. During depressive episodes, the idea of somebody who is depressed is somebody who stays in bed, who doesn't like to leave the house, who's not dressing themselves, who's not bathing themselves, who's not taking care of themselves. That all describes me during depressive episodes. I'm very easily emotionally triggered. I have panic attacks if I attempt to do things that are normal for other people, such as leaving the house, going places, driving. Make it extremely difficult for me, actually downright impossible for me to hold down a job, which is why I am not ashamed to admit that I am applying for disability, for medical disability. I'm not approved nor denied at the time of this video, although chances that I will be approved are very slim. And if I am denied, I'm not sure what I plan to do at that point. Anyway, comorbidity is illnesses that occur alongside the main problem, and for me the main problem is my bipolar disorder. But comorbid with bipolar, I suffer from generalized anxiety disorder. I suffer from panic disorder. I have had therapists and psychiatrists consider schizoaffective disorder because of my visual and auditory hallucinations. It's just, hard. I mean, when you tell somebody you have generalized anxiety disorder, it's like, that sounds so stupid. I also have obsessive compulsive disorder. It manifests in a very triggering way, in the fact that if I do not do things in a particular way, or if I do not do things in a very specific way, I am overwhelmed with the thoughts and ideas that loved ones may be hurt, that people close to me may be hurt, that I may be hurt. And so I do things consistently in a repeated pattern, not like flipping on and off a light 15 times, but things like, if I am driving somewhere, I will not drive a direction that I'm unfamiliar with. I don't like to learn new things or do new things. My cat is meowing at me. And it's very stressful, not just for me, but for my family members. He's just meowing at me. I fed him already today. And so a lot of people don't understand that those of us who suffer from mental diseases or disorders, we understand. I know, and I know that if you out there watching suffer, that you know that your loved ones are affected by what happens to you, by what you do, by what you don't do. I've had to beg people to leave work because I couldn't be alone. I've had to ask family members for money when in manic episodes I have gambled rent away. It's not just little things. It's not just, small things that happen. It's life altering choices that you make without even having the capacity to realize that you're making them. That is not to say that there is a severe lack of understanding and a severe lack of medication and help and support and outreach places for people who suffer from mental disease or disability to go to and say, I need help, because it doesn't exist. I can tell you this right now. Those places don't exist. I have been hospitalized. I've been psychiatrically held against my will. And there wasn't anyone who understood. There wasn't anyone who was trained to understand. There wasn't anyone who was trained to advocate for us. Not because there was no one who wanted to, but because there was not money. There wasn't state funding. There wasn't federal funding. And there will be even less if this horrific American Healthcare Act gets passed. And I cry at night, thinking to myself, what happens if my partner loses his job and I don't have medical anymore? That I have a pre-existing condition that will cost me thousands of dollars that I don't have to spend, thousands of dollars that I don't deserve to have to pay, because mental health treatment shouldn't be so stigmatized. It shouldn't be so difficult to receive. The doctor that I see, I've seen for 8 years. To my best knowledge, there are 4 practicing psychiatric physicians or psychiatric nurses who are, I'm not sure what the term is, but they're allowed to prescribe medication, and there are 2 talk therapy. So 6 people practicing out of one office. And even with an appointment, if you go in, you know you're gonna wait. I know. My appointment's at 2. I show up at 2, and I don't get seen till 3 o'clock because there are so many people who need help. And they're one of the few offices in Las Vegas, which is where I live, that accept children as psychiatric patients. To let a child with a mental illness, a psychiatric disorder, go their life and grow up thinking that the way they feel is normal, that the way they feel is how people feel, is cruelty. It's inhumane. This should never happen to any child. It should never happen to any adult. The statistics in regards to the homeless population and mental health, the statistics in regards to war veterans and their mental health, shouldn't happen. That shouldn't happen. So let me talk to you about me and my mental health. I was first diagnosed as having clinical depression when I was 13 years old. A depressed 13-year-old. Like, how is that even possible, you know? But I didn't take medicine. I didn't take any medicine for it. I saw therapists. I did talk therapy. And when I was 17, it became worse. I had a lot of things that happened in my life at that period of time that really, really exacerbated the problem and really brought my mental health problems to the forefront of my life. And so I went back to the doctors and they said clinical depression. They put me on so many different drugs. Paxil didn't work. Prozac. When I was on Prozac, I would get extremely angry. I would get like just furious, and not just angry, but like physically angry. I threatened my mom with a knife, and it wasn't me. Everyone agreed it wasn't me. So I was taken off Prozac. I didn't go back on another medication for a long time after that. I did therapy. I did electroshock therapy. I did all sorts of things to try and cure me. But there's not a cure. There's not a cure, and nobody wants there to be a cure. Nobody cares enough about millions of people who suffer from mental diseases to find cures for any of them. I eventually, I got older, and as I was able to get older and become an adult physically and mentally, I don't know that I was mentally an adult. I don't know if I'm mentally an adult now, but the bipolar disorder really began to become more obvious because I had my first manic episode, and what I did during that time, I was extremely promiscuous sexually, and I didn't feel like I was being taken advantage of. I didn't feel like, this wasn't rape, this wasn't sexual harassment, this was something that I wanted, that the manic part of my brain wanted. And so I stayed manic for weeks on end, and then I'd be depressed, and then mania would come back, and I'd be manic, and it felt so good. It was like being high on a drug that just doesn't quit. And then the depression would come back, and you're just crashing. And you try to escape the crash. And for me, that was by doing the same behaviors that I did while I was manic, except they didn't feel the same. It was self-harm. It was suicide attempts. I was hospitalized for my first suicide attempt when I was 17. And then I got pregnant. I had a child. I settled down. But the problem didn't go away. It didn't go away. There was not a magic cure. I still had episodes of mania, but they resolved themselves a different way. It was shopping. Spending money. It was arguing with my significant other, and it was throwing things and being just violently angry. I got pregnant for a second time, and the emotions were too much. I couldn't drink, I couldn't smoke, I couldn't do anything because I didn't want to harm the baby. So I returned to self-harm. I had to leave work to get stitches, and I finally saw a therapist who said, "You're bipolar." That was the first time that anybody had ever told me that, and I thought to myself, oh my God, I've been sentenced with a death sentence. Because, at the time, at any time, bipolar is not a trendy disease, That's what, if you tell people that you're bipolar, they look at you like you're gonna kill them. They really do. Try telling it to somebody, even if you're not. Try telling it to somebody. She put me on Zoloft. It was determined that taking that risk was better for us both. And he was born perfectly healthy. I stopped taking Zoloft after his birth because I had moved to Las Vegas. I didn't have a psychiatrist here. Things got pretty ugly again. I was at my work. I was having breakdowns. I was having to leave work early. And finally, I took Medicaid, and I looked up, and there was only one group offering, practice for Medicaid patients, and that's where my doctor was. And so I went to him and I told him. He prescribed me so many different drugs, and they didn't work, He would think I was a pill addict or something, but it just didn't work. And so now I'm on lithium, I'm on Celexa, I'm on Xanax, I'm on Seroquel. These drugs are going to kill me. They make things good now. They make things better now. But I can't take lithium my whole life. I'll need a kidney transplant, Seroquel makes you crazy. Xanax. If I tried to stop Xanax cold turkey, I'd probably die from the withdrawal. These are drugs that are going to kill me.
but they're prescribed so that I don't kill myself. Because that's what mental health problems do. No one with mental illness wants to hurt anyone but themselves. People with mental health issues want to hurt one person, only one person, and that's them, and that's me. You don't have to worry about me taking a gun into a theater. You don't have to worry about me making a homemade bomb. I don't want to hurt anyone. But I hate myself. I hate myself so much. It's ironic, you know. You can kill yourself, you can commit suicide, or there's the whole idea long-term suicide. People who suffer from depression or mental illnesses, and they drink, and they smoke, they do drugs, they do dangerous activities, knowing that one day those things will kill them, but they don't care because they want to die anyway. You didn't know that, did you? If you have mental illness, you did. And now everyone. It's not about the mental illness. It's about the person. The person that chooses to make a bad decision. I have chosen to make plenty of bad decisions in my life, and I'm very fortunate that none of those decisions hurt anyone. And I'm sure there are people who chose to make a bad decision that hurt someone while in a manic state, while in schizophrenic state, who realizes later what happened and is regretful. But that's not their mental illness. That's the person making that choice. So if somebody has the courage to open up to you and says, I'm depressed, I have anxiety, sure, you'll be fine with that because those diseases are trendy. Those diseases don't worry people. But if somebody comes to you and they say, I have schizoaffective disorder, I have schizophrenia, I have bipolar disorder, don't act like they've just told you they have leprosy, AIDS, that by contact you're automatically a walking dead man. Because that person is still the same person that you know. That person is still the same person that you love. And they love you enough to share something that is so desperately private for them. Just take it to heart. Just know that, everyone, anyone you know could be walking around with this weight on their back. Doesn't stop them. Doesn't stop me. Doesn't stop them. Doesn't stop you. And you are who this video is for. If you're young or you're old and you're afraid, don't be afraid. Because you are loved with or without your mental disease or illness, by so many people, by me. And you can always come to me if you have any need of help, advice, questions. We need to break the stigma. We need to break this barrier. We need to break down the idea that having a mental disease is the same as having an executioner's knife. Because it's not. It's having a disease. It's a disease like any other. No one blames the cancer patients. No one throws stones at an AIDS patient. Why is mental illness different? If you met me, would you hate me? Think about it.